Welcome to EEGmaster.com, your go-to resource for learning EEGs. In this short video, we will be discussing relative alpha variability, a trend typically used for detection and monitoring for ischemia. Relative alpha is ratio of power in the alpha frequency band to the overall power. Relative alpha variability, as the name suggests, looks at the variability in this ratio over a period of time. This trend, alongside alpha-delta ratio, has been studied for its utility in monitoring for diffuse cerebral ischemia in the setting of subarachnoid hemorrhage. As the ischemia develops, there is a relative drop in the alpha frequencies as well as a decrease in variability seen in alpha power over time. Separate location-based RV trends can be made for each hemisphere, quadrant, or 6 subdivisions including the right and left frontal, centrotemporal, and parietooccipital regions. RV is qualitatively graded by visually inspecting the histograms of 8 to 12 hours long segments. The grades include excellent, good, fair, and poor variability and compared against a baseline. A new and persistent drop in RV grades is concerning for diffuse cerebral ischemia. After obtaining an initial baseline, excursions from baseline occurring once per hour or of greater than 15% of median value are graded as 4 or excellent. Excursions of 10%, at least every 4 hours, are scored as 3 or good. Smaller and frequent excursions are scored as 2 or fair, and no excursion greater than 2% is scored as poor or 1. In practice, grading based on this visual template can help in qualitatively grading the variability. In a cohort of 32 patients with subarachnoid hemorrhage, Vespa et al. Reported a positive predictive value of 76% and a negative predictive value of 100% for detecting DCI using relative alpha variability. A reduction in RV preceded the diagnosis of angiographic vasospasm by an average of 2.9 days in over 50% of patients. RV detected brain dysfunction before TCD detection in over 70% of patients. Rosenthal et al. Demonstrated that when combined with other EEG alarms for ischemia, such as new epileptiform discharges, new focal slowing, and the alpha-delta ratio, the prediction of DCI in lower-risk subarachnoid hemorrhage patients achieved 91% sensitivity and 83% specificity. In higher-risk patients, the sensitivity and specificity for predicting DCI were 95% and 83%, respectively. To put this in perspective, the reported sensitivity of transcranial Doppler for detecting vasospasm is 67% for middle cerebral arteries and 42% for anterior cerebral arteries, with specificity at approximately 99% for the middle cerebral artery and 69% for the anterior cerebral artery. TCDs are typically conducted once daily, providing a snapshot view, although robotic TCDs offer the potential for more extended monitoring. In contrast, QEEG provides a continuous and prolonged neuromonitoring tool for detecting ischemia.